Today I'm going to be performing a cardiovascular assessment on Sam. Sam, can you please confirm for me your age and date of birth?
My age is 21 years old and my date of birth is 30th of March 1995.
Okay, excellent. So I'm going to be performing a cardiovascular assessment on you. Part of this will involve me listening to the sounds of your heart, your chest, your lungs, and the pulses in your arms and your neck. To do this, you'll have to remove your shirt. Is that okay with you?
Yep.
Okay, excellent. Now before we get to that part, I'll just run through a couple of things first. Now, are you in any pain at the moment?
No.
Okay, do you or anyone in your family have a history of cardiac events?
No.
Okay, are you on any medications?
Nope.
Feeling short of breath?
Nope.
Okay, cool. I just want to ensure and to point out that the area around you is a safe environment, so we can proceed safely. Okay, you can now remove your shirt. Okay, so with this assessment, I'm going to start off with looking at your hands. So if you could hold them out for this for me, please. Thank you. Okay, I'm just looking at your nails first. There appears to be no brown streaks, which would be splinter hemorrhages, which is good. The temperature is nice and warm. Your hands are not cold and clammy. Neither are they blue, which indicate hypoxia or oxygen deprivation. Yep, you're well perfused. Okay, please turn your hands over like this. There are no indications of lesions on the other side either, and the conditions are the same as before. Turn your hands back over, please. I'm just going to perform a cat pre-fill on both hands. Under 2 seconds. Excellent. Now please take your 2 forefingers and put them together like this. Okay, there's still space, there's a diamond-shaped space between your fingernails, which is good. If I stop doing that. Although if they were not like that, they would have indicated finger clubbing, which would be related to congenital heart failure. Now I'm going to listen to the pulses on your arms, so starting with the radial pulse, which is in your wrist. Feels strong and regular, as does the other one. Now do the brachial pulses in your elbows. Strong and regular. Also strong and regular. Excellent. Now I'm going to measure the pulses in your carotid arteries, which runs in your neck. I'll do that one at a time, so look this way please. Strong and regular, please look the other way. Strong and regular. All of them appear to have good volume, which is excellent. Now I'm going to do one more assessment of your brachial pulse, but this time I'm going to be lifting your arm up. If you're in any pain during this point, please let me know. Okay? And up we go. Excellent. Your pulse remains consistently strong, and so that means there's no chance of aortic regurgitation or resistance. Now I just want to be placing some pressure on your abdomen, okay? And while I'm doing this, I want you to look the other way, because I want to examine your jugular vein pulse. To indicate that you're healthy, there should be a momentary bump, a rise in your JVP. If it isn't healthy, it will remain raised while I release pressure. And please let me know if you're in any pain when I do this. Excellent, just a temporary bump. All healthy there, mate.
That's good.
Yes, it is, isn't it? Okay, so now I'm going to be examining your chest for any evidence of scarring or deformities. No, there doesn't appear to be any. Now if you could please just raise your arms. Thank you. There is no sign of scarring underneath them either. Before we proceed any further, I would just like to point out that I would take a blood pressure, see how that's functioning. Also, could you please pull down your eyelids? Thank you. There is no evidence of conjunctivitis, nor is there any lack of perfusion, which is good. Thank you. Can you please open your mouth and lift your tongue to the top of your mouth? No evidence of iron deficiency and lack of perfusion. Again, awesome. Okay, so now I'm going to begin palpations on your chest. First off, I'll begin with feeling for your heartbeat here. I can feel it. And now I'm going to be placing some pressure on your 2nd to 5th intercostal spaces. Please let me know if this hurts. Clavicle. Okay. 2nd, 3rd, 4th, and 5th. Excellent. Right. Now I'm going to be doing a freeway palpation of the chest, okay? Check, and now this is going to involve me checking for any heart murmurs. Okay, so 1, 2, and 3. Any pain at all during that one? Okay, that's excellent. Now I'm going to be oscillating your chest all around the heart valves to check how they are functioning. Starting off with the aortic. Functioning. Now the pulmonary. The tricuspid. Also functioning. And lastly the mitral. This could be a little bit cold. Also functioning well. Now I'm going to flip the stethoscope over and listen to the valves again. Pulmonary, tricuspid, and lastly the mitral. Okay mate, now what I want you to do is to roll over into your left side please while I listen to the mitral again and also listen to the axilla. Thank you. There you go. Excellent. And then both sound excellent. You may roll back over to your back now. Okay, so now what I want you to do is to sit up straight, please. Now I'm going to listen to your aorta. During this time, I want you to take several deep breaths while I also take your chest.
Okay.
Okay. And deep breath. Release. In. And out, please. Excellent. Now I'm going to be auscultating the nodes on the rear of your back for your lungs. Okay, I want you to breathe in deeply again. In. And out. In. And out. Now for the other nose. In. Out. And one more time, please. And out. Thank you. Now I'm just going to palpate your sacrum and make sure that there's no swellings or any indications of cardiac issues down there. Okay, excellent. Any pain, mate?
No.
Okay, good. You can lie back down now. Okay, thank you very much. Now I'm going to be examining your ankles to make sure there's no evidence of edema down there. Before we go any further, your ankles, they present normally? This is how they normally look? Okay, cool. I'm just going to do some palpations. Okay. Any pain?
No.
Okay, that's fantastic. Okay, thank you very much, Sam. I'm just going to do my summary now. So, in summary, my patient is a 23-year-old male who I've just performed a cardiovascular assessment on. When I found the patient, he stated he was not short of breath, nor was he in any pain. He has no cardiac history within himself or his family, and he was not on any medications. And so after that, the palpations revealed no major abnormalities. The first and second heart sounds were normal, and there were no added sounds either. No heart murmurs were revealed, and the perfusion across his entire body seemed normal. As such, I would conclude that my patient's status is of the low acuity end of the scale, although seeing as can't be entirely sure this is not a cardiac case, I would suggest applying the 12-lead ECG and a recommendation to go to hospital. Seeing as it's a low acuity case, it also rank as a status 4. However, if any of these symptoms presented in the opposite of what I've discussed, in that case it would be a status 1 case, and I would recommend immediate transport to hospital for immediate medical attention. Thank you very much.